varicose vein, long standing, will definitely cause a venous ulcer. That is the complication of it. And other complication includes like sometimes thrombosis happen. That is blockage of the vein, which becomes sometimes painful. Nowadays, we have very good modalities, like it's a one-day treatment. So now we have the laser surgery. It's like a needle hole surgery. There are no cuts, nothing. Earlier, we used to remove the whole vein. So we advise them that you have this initial stage, so you can do.
Hello and welcome to Season 2 of Health Charcha, the podcast where we simplify healthcare, share real-life stories, and explore medical innovations that are improving lives every day. I'm your host Kartik, and today's conversation is one that deserves a lot more attention than it often gets. We are talking about venous ulcers, a chronic and often painful condition that affects many. What's more concerning is that these ulcers can take months, even years, to heal if left untreated. In this episode, we'll understand what venous ulcers are, how they are different from other types of wounds like diabetic or arterial ulcers, and how vein disease, especially when left unchecked, can lead to these complications. We'll also explore essential care tips, treatment options, and the lifestyle changes that can make a lasting difference in healing and prevention. With us today is Dr. Suhail Bukhari, a vascular specialist with the expertise in vein disorders and management. Dr. Suhail is a vascular surgeon practicing at BLK Super Speciality Hospital, New Delhi. Dr. Suhail will share his expertise and knowledge on venous ulcer conditions and how to prevent them and shed light on the importance of early intervention. Welcome to HT Smartcast, Dr. Suhail. I hope this conversation is going to be really fruitful for all our listeners and viewers, and I'm sure your expertise will pour in magic to this conversation. So thank you so much for sparing your wonderful time.
Thank you. Thanks a lot for calling me and discussing the disease, which is like a main concern for Indian population these days, because our lifestyle has changed and we take long hours of sitting and standing. So that make a lot of things changing in our habits, and disease is increasing these days.
Well, Dr. Suhail, we'll come back to the basics first. Venous ulcers. Anytime when a medical jargon is being thrown around on people's head, they go bizong, they go bonkers. They don't really understand what the condition is, how badly it can affect their body, how badly it can mentally affect their relatives, their parents, their friends and family. Before we start this conversation, before we dig in deeper, I would like you to shed some light upon what actually venous ulcers are.
Okay, so if we see initially what happens, there are like arteries which take blood down to the leg and veins which bring blood back to the heart. So that is a normal anatomy.
Okay.
And we are provided with two systems of veins. One is superficial system, one is deep system.
Okay.
So what happens when the superficial system becomes dilated because of long standing? So there is stagnation of blood into the superficial venous system.
Okay.
So which causes later on the long periods and couple of years, so they keep on stagnation of blood causes dilatation of the veins, and which causes leakage, micro leakage of the blood, and it causes pigmentation around ankle and swelling and sometimes tiredness for when we stand for long hours. Maybe in the like evening you feel tired in your calf. So these are the initial symptoms. So if we ignore them, then these pigmentation later on become ulceration because of itching and eczema develops. And these ulcers become chronic and they won't heal unless we take out the venous pressure. So for that, we have to do a lot of modification, and newer surgeries and modalities are available.
Okay.
So this is venous ulcer. Whereas in diabetic and arterial ulcers, which are like because of blockage of the artery, there is no flow going down to the leg, ankle or toes. So they become ulcerated or gangrenous changes, that is blackening of toes happens. So that is blockage of the artery. Same thing in diabetics, because arteries over the period of time when you have a long standing diabetes, arteries become narrow and there is no flow happening to the foot or toes. So because of that causes ischemia, that is blockage of the artery and no oxygen reaching to the skin and the
Skin.
tissue.
Hmm.
So that causes ulceration. So these are the differentiation. So when we see clinically, when we examine, although arterial pulses are there, but there is still ulcer and blackening around the ankle.
Okay.
So that is a venous ulcer.
Okay.
And it has a specific side on the medial side, that is the inner part of your ankle. That is the most commonest site where you develop the ulcer.
And now that you have given us again about what ulcer 101 actually means, what is the difference between venous ulcers, arterial ulcers, and diabetic foot ulcers, there is one big statement that is being passed around on the internet. And these days, everyone has a habit of going to Google Baba, asking questions. There is one huge debate that goes on that if varicose veins are left untreated, they can also lead to venous ulcers. Is that correct?
Yeah, that is 100% correct. So, if sometimes when the long-standing varicose vein happens, as I said, there will be a continuous pressure, and maximum pressure because of the gravity would be at the lowest part of your leg, that is around ankle. So, veins become more pressure and it burst open, and there is a leakage of the blood into the skin, which causes irritation. That's why pigmentation happens, then eczema happens, then ulcer happens. So varicose vein long standing will definitely cause a venous ulcer. That is the complication of it. And other complication includes, like, sometimes thrombosis happen, that is blockage of the vein, which becomes sometimes painful. And sometimes patients develop deep vein thrombosis. That is, I told you, superficial system and deep system.
Deep system.
So sometimes deep venous system become thrombosis. So thus all the load of venous returns come to the superficial system.
Okay.
So sometime post DVT, that is deep venous system thrombosis. So the superficial system become dilated, and if it is not treated well in initial stage, that is deep venous thrombosis, it causes varicose vein and venous ulcer.
Okay. Doctor, just to follow up on this, now that we know about what venous ulcers are, arterial ulcers are, and what diabetic ulcers are, diabetic foot ulcers are, to be more precise, we live in a country where we have a tendency of neglecting things.
Yeah.
हम अपने friends and family से मिलते हैं, कभी कभार उनसे मिलके हमें लगता है कि ठीक है, किसी को फैमिली में हुआ होगा तो वो हमें एक ओपिनियन दे देता है.
Correct.
आप ये नुस्खा ट्राई करो. There is always an ancestral tree that comes into existence, and they say that, you know, हमारी दादी माँ ये कहा करती थी, हमारे पेरेंट्स ये कहा करते थे, तो आप ये कर लो. और काफी टाइम हम उस कंडीशन को अनट्रीटेड छोड़ देते हैं. So, firstly, I want to ask you, what are the stages of venous ulcers? Beginning में क्या होता है, intermediate level पे क्या होता है, advanced level पे क्या होता है. The second thing is, when we talk about venous ulcers, what will happen if we leave venous ulcers untreated?
Yeah, so it's a good question. So this is very common. मतलब whenever it's in Indian culture, अगर आप किसी से अपनी बीमारी डिस्कस करेंगे, he will give you 3 or 4 medications या कोई आपको घरेलू नुस्खे वो बता ही देगा.
Correct.
सो वी सी पेशेंट्स जब वो सारी चीज़ें ट्राई करके आ जाते हैं, आयुर्वेदा, लीच थेरेपी इज़ वेरी कॉमन. उनको लगता है कि ब्लड लेटिंग से ठीक हो जाएगा. नाउडेज कपिंग इज कमिंग इनटू द वोग, एंड सम होम्योपैथी, वो सारी चीज़ें करके आ जाते हैं. समटाइम पेशेंट कम कि जी पहले मैं ये करा के देखता हूँ, देन आई विल कम फॉर सर्जरी, बिकॉज अल्टीमेट ट्रीटमेंट फॉर वेरिकोज वेन इज सर्जरी. There are different type of surgery that we can discuss later. But sometimes in India, until unless you become debilitated, बहुत ज़्यादा आपको जब तक जख्म नहीं बन जाता, अल्सर नहीं हो जाता, या नस वेरिकोज वेन की नस फट जाती है तो ब्लीडिंग होती है.
Correct.
Then only they'll get surgery done. Initial stage में surgery is very easy, and without going to the complication, it can be treated easily.
Okay.
But unfortunately, we have a mindset कि जब तक complication नहीं होगा, चलता है, attitude is very common. And especially in young females, post pregnancy, because uterus compresses the vein of the abdomen.
Okay.
So जो leg की vein होती है, female get swelling and veins के अंदर blood इकट्ठा हो जाता है. After delivery, it returns back in some percentage, like 8 to 15%, vein doesn't return back to the normal size, and they develop varicose vein.
करेक्ट.
So that is another cause. या कई बार क्या होता है कि किसी के abdomen में कोई पैथोलॉजी है, I mean जब आता है तो we try to screen everything, take proper history and see what is the cause of it. Sometimes it is genetically.
Okay.
कि parents को भी है, then kids
It's
are
being
having.
passed on from generations.
Yeah.
Correct.
And especially people who are standing for long hours, it's very common, like even doctors who are doing long surgeries.
Correct.
Then policemen, the people who have long standing hours, 8 to 10 hours without resting.
Correct.
So that is very common.
डॉक्टर सोहेल, बहुत सारी बार ऐसा भी होता है कि जब हम किसी कंडीशन के बारे में बात करें, किसी डिजीज के बारे में बात करते हैं और उसका जब ट्रीटमेंट हो जाता है तो बिकॉज इट्स ह्यूमन टेंडेंसी, इट्स नेचुरल ह्यूमन टेंडेंसी, प्लेसिबो इफेक्ट और आपका जो मेंटल हेल्थ है वो हैम्पर होता है. आपको प्लेसिबो होता है कि ये वापस तो नहीं हो जाएगा, व्हाट इफ समथिंग गोज बैड. ऐसा चांसेस होते हैं व्हेन इट कम्स टू venous ulcers. Once it's treated, there is always a chance of recurrence happening in the body.
It's a very rare thing. I would not say recurrence. Normally हमारे यहाँ recurrence की definition अलग है. जैसे पेशेंट को एक बार राइट लेग में हुआ, उसकी उसने ट्रीटमेंट करा लिया, सर्जरी हो गई,
करेक्ट,
अब उसको लेफ्ट लेग में हो गया बिकॉज ही हैज अ टेंडेंसी टू वेरिकोज वेन्स. तो पेशेंट उसको भी रिकरेंस कंसिडर करता है. कई बार क्या होता है कि आपके सुपरफिशियल सिस्टम में जो बाहर का सिस्टम है उसमें हो गया, उसको हमने ट्रीट कर दिया. फिर समटाइम्स बिकॉज देयर आर सो मेनी वेन्स ओवर द पीरियड ऑफ टाइम 10 years, 15 years, 20 years, दूसरी वेन्स के अंदर कई बार वेरिकोज डेवलप हो सकता है. तो उसको भी लोग रिकरेंस बोलते हैं कि जो हमने कराया था अब दोबारा हो गया है हमें.
ओके.
सो मोस्ट ऑफ द फीडबैक क्या मिलता है कि सर्जरी मत कराओ, ये दोबारा हो जाएगा. सो देयर कम्स लाइक बिकॉज हमारा इतना डिस्कशन होता है आपस में किसी भी बीमारी को लेके in family and relatives and friends, so everybody give their inputs.
Correct. And there is always a talk of the town when it comes to post treatment care, because that is one of the most important things. Every time when you are diagnosed with a condition, every time when you are diagnosed with a disease and you go for a treatment and you're done with the treatment and the doctor says now you're free from this, the definition of free, the connotation of free is a little different. The connotation of free means that you have to still take care of yourself. There are post treatment care that needs to come in place. You have to avoid few things. कुछ चीजें ऐसी होती हैं. So what are those post care treatment that patients should remember and they should apply?
Like post care and pre care is sometimes when you have an initial stage. So we detect it with the ultrasound.
Correct.
There is a Doppler, because we call it venous Doppler.
Okay.
That is sort of an ultrasound, non-invasive thing. So that detects how much varicosities are there, what is the grade of varicosities, and how much blood is getting reflux. मतलब वापस उसके अंदर कितना blood जा रहा है. So because there are multiple valves in veins which allow each blood column to move up towards the heart. तो बिकॉज ऑफ डायलेटेशन वाल्व्स जो होते हैं वो दूर हो जाते हैं.
Okay.
वो आपस में मिलते नहीं है, तो वो उस ब्लड कॉलम को एक जगह रोक नहीं पाते. सो बिकॉज ऑफ दैट व्हेन दे बिकम्स अपार्ट, सो ब्लड गेट्स स्टैग्नेंट एंड वेन्स डायलेट हो जाती है.
Okay.
सो फॉर दैट वी से आइदर यू डू लेग रेजिंग एक्सरसाइज, calf exercise, movement of calf, so that causes blood returning back and stagnation कम होता है. Or wear external compression, we give stockings, which are customized stockings which you have to wear so that external compression रहे, उसके अंदर blood इकट्ठा ना रहे. Like some patient उनको initial varicose veins है but वो surgery for any reason नहीं कराना चाहते, so they should wear a stocking, compression stocking, which is custom made according to their leg circumference size, so that they can wear every day in the morning and evening they can remove. उससे क्या होगा कि blood इकट्ठा नहीं रहेगा veins में because compress हो गया है वो, तो venous ulcer के chances बहुत reduce हो जाते हैं. So they can prolong it. Ultimately सर्जरी करानी पड़ेगी कभी ना कभी, but they can prevent it. Sometimes होता है कि अभी हमें नहीं कराना, कोई कुछ है फैमिली में इश्यूज हैं, फाइनेंशियल इशू, जो मल्टीपल रीजंस हो सकते हैं, या अभी तबीयत खराब है, व्हाटएवर. एंड एजेड पेशेंट है, अभी सर्जरी नहीं करानी है, सो दे शुड वेयर स्टॉकिंग्स. Same thing, once we do the surgery or any surgery, we advise them to wear at least 2 to 3 months stockings.
Okay.
So that compression happens and then they are free for that.
Okay. And Dr. Suhail, coming down to my last question of this podcast, I mean, and this is going to be really personal for you, I believe, because once you get a doctor friend or somebody who is a relative or somebody who's a family member who is into this profession like you, and you have been serving in the fraternity for so long, I'm sure you would have gotten a lot of questions like these ki kaise early treatment, कैसे अर्ली डायग्नोसिस हमें पता चले वीनस अल्सर्स का. व्हाट आर दोस साइंस एंड सिम्टम्स जिससे हमें पता चले कि हमें वीनस अल्सर्स है. व्हाट आर दोस अर्ली स्टेजेस, कुछ चीजें ऐसी जो हमें पता चल जाए, एंड व्हाई इज इट सो इम्पोर्टेंट फॉर अस टू ट्रीट देम एट द अर्ली स्टेज?
Yeah, because we can definitely prevent venous ulcer to happen. So once we see there is a swelling or there is dilated veins over the legs,
Correct.
so these are the signs which you can see yourself. Sometimes we see young females coming with that spider veins. So but females में क्या होता है, usually fat component ज़्यादा होता है, तो veins कभी नजर नहीं आती है, only spider veins नजर आती है, which is like they are worried for cosmetic thing here. They don't know that inside they might be having a varicose vein. So we advise them to get a Doppler done because Doppler can pick up.
Okay.
समटाइम्स विजिबल नहीं होता वेरिकोसिटीज, सो उसके अंदर स्पाइडर वेन्स में डॉपलर से पिकअप हो जाता है. सो वी एडवाइज देम दैट यू हैव दिस इनिशियल स्टेज, सो यू कैन डू लेग रेजिंग एक्सरसाइज लाइक 90 degree every 2 to 3 hours you can do, so that blood can pool back. And you have to wear stockings, or we have medications which increase the venous tone. वेन की जो कैलिबर होता है उसके अंदर जो मसल होता है उसको वो venous tone को इंक्रीज करते हैं, which will help us initial stage mein.
Okay.
So that can be done.
Well, thank you so much, Dr. Suhail, for sparing your wonderful time and shedding light on this important topic, because this is actually the need of the hour. We need to make our citizens aware. We need to make the society aware what venous ulcers are. And it can be a little overwhelming for patients and for their caregivers. But with the right kind of knowledge, with the right kind of treatment, they are manageable, they are treatable.
And nowadays we have like all very good modalities, like it's a one-day treatment. So now we have the laser surgery. It's like a needle hole surgery. There are no cuts, nothing. Earlier we used to remove the whole vein ताकि उसमें blood इकट्ठा ना रहे. Principle is blood इकट्ठा ना रहे, either by external compression, remove the vein. Now we have laser surgery, which is like a needle hole. So we block the whole vein so that blood इकट्ठा ना रहे. Then radio frequency है. And nowadays less painful is a glue treatment. So we give the glue so that fibrosis and veins जो होती है वो collapse हो जाती है permanently.
Okay.
तो उसमें blood इकट्ठा नहीं रहता, then your venous ulcer is treated with that.
Well, thank you so much, Dr. Suhail, for sparing your wonderful time and your knowledge. And I'm sure this session is going to be really fruitful for all of those people who are suffering with venous ulcers, or their parents or their loved ones are suffering through these venous ulcers. And I'm sure that this session was as important for me, as important for all the viewers out there. So thank you so much.
Welcome.
Well, that brings us to the end of the episode of Health Charcha, issued in public interest by Medtronic. So if you or your loved one are dealing with a wound that won't heal, especially around the legs or ankles, don't delay. Seek professional advice. Early diagnosis, consistent care, and the lifestyle support can make a world of difference. And for more details on advanced vein treatments and recovery tips, speak to a vascular specialist. Until next time, this is your host Kartik, signing off. Thank you so much.